Setting, medical clinic. Your 60-year-old patient has type 2 diabetes, which has been moderately well controlled by diet and oral medication until now. However, recently, the patient's blood sugar have been high. The doctor has decided to commence insulin injections. You're seeing the patient to show him how to administer injections. Hi, my name is Sakura. I'm the nurse at this medical clinic. How are you today? Good, thank you. Great. Now, before we get started, I'd just like to confirm your name. Yes, my name is James. Wonderful, James. Now, I understand that you're here because you have type 2 diabetes, which has been fairly well controlled up until now, and you've been taking oral medications for that. However, recently your blood sugars have been a bit high, and the doctor would like to get you started on some insulin injections. Is my understanding correct? Yes, that is. Okay. Well, I would like to find out a little bit about how you're feeling about the injections. Well, I'm a bit anxious and I'm not sure about starting insulin injections. I've been managing my diabetes well until now. Okay, I see. And I just want to ask a little bit more about why you might be feeling a bit anxious. So is it the injection process that you're anxious about? Well, I just don't really like the thought of injecting myself. I don't think I'll be able to do it. Okay, I see. Some people are a bit, fearful about the pain as well. Do you think it might be the pain? I don't know. I just don't like the thought of injecting myself. Okay, I see. So I understand your concern about, injecting yourself. It can feel a bit scary. However, I'm going to try my best and give you very clear instructions. And also, it does get easier with practice as well. And it is very important that we do get you started on insulin injections at this moment. Has that been explained to you by the doctor? No, not really. Okay, I see. So it's important that we get you started with the insulin injections because the injections are absorbed a lot faster into the bloodstream. So it's not broken down in the stomach like the oral tablets are, which means it's much more effective. Any concerns or questions so far? Well, yes, I'm just wondering, is there another way to manage my diabetes? Okay, I see. That is a good question. However, the injections are the best option available at the moment. This is because the current management is not really working to control your blood sugar. Now, any questions or concerns so far? No, that's okay. All the information is clear. Okay, I see. Now, I'd like to move on to talking about the injection giving process. Have you ever injected yourself before? No, I haven't. Okay, I see. Now, I'm going to explain the process. If any of it feels a little bit uncomfortable for you or you want me to stop, please let me know. Okay, no problems. Okay, so first, it's important that you're going to wash and dry your hands. After that, you're going to pinch your skin on your stomach, okay, and then insert the needle at a 45 to 90 degree angle. Please leave it in place for about 5 to 10 seconds for the insulin to absorb. And it's important that you also rotate the injection site to prevent the formation of lumps. If the lumps do form, this can risk less insulin being absorbed. Is everything clear so far? Yes, it is. Okay. Now, I would like to talk about how to dispose of the needles. So I'm going to give you a container for you to put the discarded needles in. It's important that you take care of this container and you don't drop it or you don't lose it anywhere. With the insulin, I would like for you to store that in the fridge. So any unopened insulin should be stored in the fridge and avoid exposing it to sunlight or high temperatures as well. Before you use the insulin, it's important that you also check for the expiration dates as well. Do you need me to explain anything again in more detail? No, I feel a bit better about the injections now, and yeah, no, that's fine. All right, wonderful. Now, if it's okay with you, I would like to now see your technique on how you're going to inject yourself. Are you happy to give it a try? Yes, I am. Wonderful. Let's get started.